Thank you, Mr. Chair. Also, thank you, Ranking Member Katko and Administrator Criswell for being here today. FEMA uses the phrase locally executed, state managed, and federally supported. This concept requires all of us to have actual capability and depth at every single level. In the past, I've asked FEMA, as they set up vaccination clinics, the level of their health personnel and emergency personnel. And given that FEMA is not, does not have expertise or scientists or health personnel as part of your personnel, can you explain to me or discuss with me how the chain of command and how the delegation of responsibilities worked? Did you work with the Assistant Secretary of Pandemic Response, the CDC, HHS, local public health? Who should be the head agency when we're dealing with a pandemic? And do we need to rethink how to score true readiness at the state, local, tribal, and territorial levels?
FEMA, the phrase that you mentioned, federally supported, state managed, locally executed, I think is an important concept for us to bring up. All disasters, I've been a local emergency manager, they start and end with the local jurisdiction. And that's the locally executed part. And the state and the federal government need to be part of that process to make sure that they're successful. The federal government does that in a number of ways by making sure that we're increasing their capacity to be able to perform their mission. When it came to supporting the vaccination effort or supporting the COVID-19 response in general, coming from my own experience in New York City, it truly was a collaborative approach of making sure that the federal government, while they're supporting, they understood the needs of the local jurisdiction and letting the local jurisdiction set the planning assumptions for them for the assistance that they were going to provide. And I think that's a really critical piece of making sure that, again, that the federal government is supporting the actual needs on the ground of what the local communities say that they have. When it comes to the federal coordination, that's where FEMA is an expert, right? We can bring in all of the federal partners. We're very good at coordinating the stakeholders and bringing the appropriate people together to support a response. And that's what FEMA did during the response to COVID-19. I think we have an opportunity to see where we need to build capacity across the federal government for certain disasters when they don't squarely fall into the disaster response role that FEMA typically does, and would be happy to work with you as we continue to have that conversation.
And then, given the scientific and medical nature of this particular national emergency, who was responsible for messaging? So, as a physician and a former director of the Iowa State Department of Public Health, there was confusion in the messaging. So, was that the responsibility of CDC? Was that the responsibility of ASPR?
The messaging was critically important through all this, and as you know very well, the stuff we learned about the COVID-19 virus changed on a regular basis. As part of the leadership role that FEMA ended up playing, we had HHS experts and medical experts embedded with us as part of that operation, because as you stated, we don't have that level of expertise. And so it was truly a coordinated approach. I would always defer to the message to be those that are the experts in that message, and then FEMA can help amplify that message.
Thank you. And then during disasters, FEMA moves resources from unaffected areas to affected areas. However, the COVID-19 pandemic affected the entire nation almost simultaneously, which led to significant supply shortages of personal protective equipment and other necessary supplies. A report published by FEMA in January found that in order to mitigate further supply shortages, FEMA should establish a long-term strategy for engaging with the private sector. How has FEMA engaged with the private sector to address resource and supply shortfalls?
We learned so much through the COVID-19 pandemic and the critical and often fragile nature of our supply chain and where we depend on things. And we were able to put in some new methodologies, working really closely with the private sector to make sure that we were meeting the needs of first responders. But it is the first time, as you stated, with disasters across the country, that we really faced a resource shortage at this level. We are working closely with the private sector to establish better relationships and understand how we can bring them in better. We can never replace the resources that the private sector brings to bear to support disaster response. And so we need to understand better what their capabilities are. And we are having ongoing conversations with different sectors across the private sector to make sure that we understand how to get them back up online faster, but also how they can support us in our response. And those conversations are ongoing.
Thank you so much, Mr. Chair. I yield back my time.